Pandemics have haunted humanity for centuries. Malaria, smallpox, the plague, and now the novel coronavirus. All of them have changed the world we live in. But have we changed the way we do things?
After the SARS outbreak 17 years ago, the world's countries promised that they would act differently in the future. They promised that they would take the threat of virus pandemics much more seriously. And I'm afraid that what the latest pandemic shows is that we have not learnt the lessons of the dangers of a virus. And that's a tragedy. It is a genuine human catastrophe.
Despite all the lessons from history, the suffering and loss from infectious diseases, we're caught up again in a last-minute rush to contain an outbreak with a cure for which success is uncertain as it ever was. I'm Ben Fazul, welcome. Will we learn our lesson this time? That's something our leaders need to have a good, long think about. It's also something I'll ask a Harvard professor about in a moment. First, a little history lesson for you.
Pandemics have shaped history. They, of course, bring with them death and economic devastation, but they can also be a catalyst for change, progress and innovation. For example, the plague, the most fatal pandemic in human history. It killed a third of Europe's population in the 14th century. As a result, labour was scarce and costly, which resulted in innovations like water wheels and mills, as well as other machinery. More houses were built from stone, which kept out disease-carrying rats and fleas. In the 19th century, there was a fifth pandemic of cholera. It spread throughout Asia and Africa and hit Germany as well, killing nearly 9,000 people in the city of Hamburg. The economic loss, 400 million gold marks. But during this time, the German scientist Robert Koch helped establish how bacteria cause disease. His findings ultimately led to the development of germ theory. Inadequate sanitation was improved too. Then came the so-called Spanish flu of 1918, the world's worst pandemic to date. As many as 50 million people died after the disease spread from animals to young farmers drafted for war. In the United States, many cities, such as St. Louis, shut down to contain the outbreak. But Philadelphia allowed a huge parade to go ahead, which sparked mass infections. It endured twice as many deaths, the worst hit US city. The Spanish flu ended up causing more deaths than the First World War. But it led to improved hygiene and advances in virology. Which brings us to today and COVID-19. Tens of thousands have so far died, and global isolation measures have led to a shutdown of the world economy. Millions of people have lost their jobs, businesses have folded. No one knows what the economic recovery will look like. But there's relief for the environment. With factories closing, air pollution has plunged. Many workers have moved online, sparking a digital revolution from public services to healthcare. The pandemic is remaking the world in real time. The question is, what comes next?
David Jones is a Harvard College professor from the Faculty of Medicine. Professor, tell us how unique this disease actually is, first of all.
I don't think we know that yet in terms of both how infectious it is and how deadly it is. It's clearly infectious enough to have spread quickly around the world, but it's probably not as infectious as a disease like measles. It's deadly enough to have caused major problems. We're now approaching 300,000 deaths worldwide, especially in the United States. That's more than the usual annual influenza epidemics, but not as bad as the pandemics in 1957 or 1968, and certainly not as bad as influenza in 1918 that killed over 50 million people.
Take us back to smallpox. What was the secret to eradicating that disease?
The secret to smallpox eradication was two things. First, smallpox doesn't have an animal reservoir, so once we get rid of it from humans, it should be gone forever. And then also we had a very effective vaccine, which allowed us to control the disease. But it wasn't easy. We had that vaccine in 1798, but the last human case of smallpox wasn't until 1978, 180 years later.
Wow.
And it required massive cooperation between World Health Organization, the United States, the Soviet Union, and many other countries to successfully eradicate that disease.
And that was cooperation that you're talking about during the Cold War. I mean, what's the difference between how things were done back then and now? Because we're not in a Cold War anymore.
They were willing to get together to eradicate smallpox, which I think shows how terrified human societies were of that disease. We know what we need to do now. We know what would be required to contain COVID. We just have to figure out how we can get the cooperation and the consensus about the best way to proceed.
And I find it pretty hard to get some sort of consensus on a societal basis. I mean, just amongst my friends and workmates. What about how society has reacted throughout the ages? What is telling there?
Societies have been dealing with pandemics for as long as we have lived in cities, and we have learned a lot from that history. For instance, we have learned that many epidemics can be controlled through isolation and quarantine. That's a very old technique, and it has worked very well in certain situations. The other disease that we seem to have eradicated is SARS. After killing 774 people in 2002 and 2003, there hasn't been a case of SARS since 2004, and that was done entirely with surveillance and isolation without a vaccine. So we know what to do if we set our minds to it. What will be required to eradicate COVID? It would be wonderful if we develop a vaccine. It will be wonderful if we develop effective treatments. But many countries have done a terrific job with the technology we already have. China and Germany have significantly reduced cases. Australia and New Zealand are on the verge of declaring the disease contained. But in many countries, especially in the United States, but many other countries in the world, the disease is continuing to spread. We just need to mobilize the resources and the political will to do what we already know, and then we should be able to achieve success.
But based on what sort of success? Because why are some infectious diseases able to be wiped out totally and others not?
There are many things that determine whether or not we can eradicate a disease. Smallpox is the great example where we have done that, and possibly SARS. But there are also diseases that could have been better contained where we have failed. HIV is the most tragic example. We knew what we needed to do in the 1980s to contain that disease, and we were unable to do so. We now have very effective treatment for HIV. If we got every person on the planet who now has HIV to take medicines reliably, if we could get them the medicines, we could eradicate HIV, but we haven't done that yet. And what that shows is it's not simply a question of having the technology needed to eradicate a disease, but also to have the systems in place to provide that care, that treatment, and the political will to bring eradication campaigns to fruition. It's too soon to tell what will happen with COVID. If there's an animal reservoir, it will be very hard to eradicate. But the success of some countries shows that tremendous progress can be made, and we just need to bring that progress to the rest of the world.
David Jones, Harvard University, thank you very much. I'm sure you've got lots of questions too. Our science correspondent Derek Williams has been busy answering all the questions you've been sending us. Keep doing that. It keeps Derek busy.
Will over-the-counter allergy medicines like Claritin suppress your body's immune reaction to COVID-19?
The active ingredient in the medicine you mentioned is loratadine. That's an antihistamine. Now, antihistamines reduce allergy symptoms by blocking histamine. That's a compound that's released by your immune system during an allergic reaction. It plays a central role in the itching and the swelling that hay fever sufferers experience. Now, because the medication interferes with an immune response, which is actually kind of a hyperimmune response, many people who suffer from allergies are worried that it could make them more vulnerable to infection with SARS-CoV-2 to take antihistamines. Currently, however, all the national allergy organizations I looked at are still saying that antihistamines are safe to take during the pandemic. If that changes, I'll let you know here.
Has thalidomide been tested?
Among the existing medications that are currently being tested as treatments for COVID-19 is one with an absolutely terrible reputation. Thalidomide is best known as the drug that back in the 1960s caused severe birth defects in the babies of pregnant women who took it for morning sickness. But it's since been redeemed to some extent and has proved effective against symptoms in a range of medical conditions, among them infections with the H1N1 flu virus. Because thalidomide has anti-inflammatory effects, researchers in different studies are now looking at whether it can slow or even stop lung damage in patients with severe cases of COVID-19. But that work is still ongoing. It's still too early to know whether it could eventually prove to be an effective treatment.
Is the internal structure and behavior of SARS-CoV-2 clearly visible under a microscope?
Not under a light microscope. The virus is only around 100 nanometers in diameter. That's much smaller than the wavelengths of light that our eyes are able to perceive. That means that under a light microscope, the coronavirus is effectively invisible. To obtain images of it, we have to use electron microscopes. By bombarding samples of the virus with streams of tiny subatomic particles, electron microscopes can resolve structures down to around a single nanometer. So they can reveal SARS-CoV-2 in pretty sharp detail.